Atorvastatin, known commercially as Lipitor, is one of the most prescribed drugs in the world, and for good reason. It belongs to a class of drugs called statins, which have a key role in controlling cholesterol and protecting our heart. But what exactly does she do? To understand, we need to talk about cholesterol. Our body needs cholesterol to function, but when it is in excess, especially the so-called bad cholesterol, LDL begins to accumulate in the walls of the arteries. Over time, this buildup forms plaques that narrow blood vessels, making it difficult for blood to pass through. This is where the danger lies. These plaques can lead to heart attacks and strokes. Atorvastatin acts directly on the liver, which is the main producer of cholesterol in the body. It blocks an essential enzyme in this production process. With less cholesterol being manufactured, LDL levels in the blood drop significantly. At the same time, the drug helps to increase good cholesterol, HDL, and reduce triglycerides. The result goes far beyond the numbers in the exams. Studies show that atorvastatin significantly reduces the risk of serious cardiovascular events, such as heart attacks, strokes, and the need for procedures such as catheterization and bypass grafts. Therefore, it is prescribed both for those who already have high cholesterol and for people with high cardiovascular risk. Even if the levels are only moderately high, like any medicine, it can have side effects. The most common include muscle pain and, in rarer cases, changes in the liver. For this reason, medical follow-up is essential, with periodic examinations to ensure that everything is under control. It is also important to remember that atorvastatin does not work miracles on its own. It works much better when combined with healthy habits, a balanced diet, regular exercise, and quitting smoking. After all, atorvastatin is a powerful ally in the fight against heart disease. But true cardiovascular health comes from a union between treatment and a healthy lifestyle. Levothyroxine, known by the trade name Synthroid, is one of the most important medications for millions of people living with thyroid problems. But to understand its role, we first need to talk about this small gland that does a gigantic job in our body. The thyroid is a butterfly-shaped gland located in the front of the neck. Despite its modest size, it is responsible for producing hormones that regulate virtually our entire metabolism. That is, the speed at which our body turns food into energy. These hormones influence the heart, brain, digestion, body temperature, and even our mood. The problem arises when the thyroid ceases to function properly and begins to produce hormones in insufficient quantity. This condition is called hypothyroidism. When this happens, the whole organism slows down. A person may experience constant tiredness, weight gain, dry skin, hair loss, a feeling of cold, constipation, slowness of thinking, and even symptoms of depression. This is exactly where levothyroxine comes in. It is a synthetic version of the hormone T4, identical to what the thyroid would naturally produce. By taking it, the person replaces what the body is not able to manufacture, restoring the balance of metabolism and making the symptoms disappear little by little. An important detail is the form of taking the drug. Levothyroxine should be taken on an empty stomach, usually in the morning with water, and you need to wait 30 minutes to an hour before eating. This is because certain foods and other medicines can interfere with its absorption. The dose is very individual and needs to be adjusted carefully by the doctor based on periodic blood tests. Both the lack and excess of the hormone can cause problems, so monitoring is essential. In most cases, treatment with levothyroxine is continuous, done throughout life. But the good news is that with the right dosage, a person can lead a completely normal and healthy life. After all, levothyroxine is an example of how a single tablet a day can return quality of life to those who need it, provided it is used with medical advice and responsibility. Lisinopril is one of the most widely used drugs in the world for control of high blood pressure. Discreet and effective, it is part of the daily lives of millions of people who need to keep hypertension under control and protect their heart and kidney health. But how does it work? Lisinopril belongs to a class of drugs called ACE inhibitors, short for angiotensin-converting enzyme. To understand its role, imagine that our body has a natural system that regulates blood pressure. Within this system, there is a substance called angiotensin, which has the power to narrow blood vessels. When the vessels narrow, the pressure rises. This is exactly where lisinopril works. It blocks the enzyme responsible for producing the most potent form of this substance. With this, the blood vessels relax and dilate, allowing the blood to flow more easily. The result is a natural and consistent reduction in blood pressure. But the benefits of lisinopril go beyond pressure control. It also plays a very important role in protecting the kidneys, especially in people with diabetes. Diabetes, over time, can damage the small vessels of the kidneys, compromising their functioning. Lisinopril helps reduce the pressure inside these delicate kidney filters, slowing this wear and tear and preserving kidney function for longer. In addition, this drug is often used in the treatment of heart failure and in recovery of people who have suffered a heart attack, helping the heart to work more efficiently. Like all medicines, lisinopril can cause side effects. One of the most characteristic is a dry, persistent cough, which affects some people. In such cases, the doctor can evaluate the exchange for another drug from the same family. Dizziness, especially at the beginning of treatment, may also occur. It is worth remembering that lisinopril should be taken every day at the same time, even when a person feels well. This is because hypertension is most often silent. It does not give symptoms, but continues to cause damage from the inside. After all, lisinopril is a great ally in protecting the heart and kidneys. Combined with a low-salt diet, exercise, and medical monitoring, it helps ensure a longer and healthier life. Metformin is considered the drug of first choice in the treatment of type 2 diabetes. Used for decades around the world, it has become one of medicine's most reliable and studied tools in controlling blood sugar. But to understand its role, we need to talk a little about type 2 diabetes. In this condition, the body still produces insulin, the hormone responsible for getting glucose into cells, but begins to use it inefficiently. This is what we call insulin resistance. As a result, glucose builds up in the blood, and sugar levels become dangerously high. It is in this scenario that metformin comes into play, and the most interesting thing is that it works in several forms at once. Its main function happens in the liver, which is a major producer of glucose. Metformin reduces the amount of sugar that the liver releases into the bloodstream. In addition, it improves the body's sensitivity to insulin, causing cells to make better use of available glucose. And it even slows down the absorption of sugar by the intestine. The result is a more balanced control of glucose levels, without provoking sharp drops in sugar, an important advantage over other drugs. Metformin also has other benefits. It often has a neutral or even favorable effect on weight, which is valuable for many patients with type 2 diabetes. And there are studies that point to additional advantages for cardiovascular health. Like any medicine, it can cause side effects, especially at the beginning of treatment. The most common are stomach discomforts, such as nausea, diarrhea, and abdominal pain. Therefore, often the dose is increased gradually, and the drug is taken with meals to reduce these discomforts. It is important to remember that metformin is not a substitute for healthy habits. On the contrary, it works much better when accompanied by a balanced diet, the reduction of sugars and refined carbohydrates, and the regular practice of physical activity. After all, metformin is a great ally for those living with type 2 diabetes. Simple, effective, and safe when properly targeted, it helps keep sugar under control and prevent complications of the disease, always with the supervision of a doctor.